what really we can choose. Dr. Nimrita.
So good morning, everyone. I think the case is not closed yet, since all the sides have not been presented. So my choice in this case for an athlete, and particularly why we're saying athlete, is we're looking at something which is called as a safety profile, I think, which is something which we are all bargaining on. So the reasons are safety profile. My safest bet is a PRK. Biomechanical strength, I think we're all talking of ectasias. I will also talk about a very scientific aspect, deformation amplitude values, which we are taking, in which PRK wins again. In my case, I will show the slides to prove. And athlete, again and again, we keep asking, his life depends on it. Is it worth taking the risk? The guy's career depends upon it. So now if we're talking of researches, I have a research to show as well. Here is a PubMed research. I searched of post-PRK ectasia, post-LASIK ectasia, and post-SMILE ectasia. If we see the search results, PRK has been in the market for the longest time. However, you see the items found in PRK are very less according to the age the PRK has. So it's the oldest technique and minimal post-refractive surgery ectasia. So again, I think hands down, we win the point here. And again, if we look at the air puff-induced corneal deformation amplitude values in LASIK, SMILE, and PRK, these are the center one shows the simulations that we had. And we know that higher the DA value, the worse it is. However, in the real case scenario, the PRK has a better biomechanical strength. Again, we are not weakening the procedure. It's not a weakening procedure. In fact, the healing process is making the cornea stronger. So again, if we talk of safety, PRK wins hands down. Now reasons is, if we're talking of PRK, let's talk of the new generation PRK as well. Now we have trans PRK in the market. So I'm going to compare between SMILE, which is the most latest one, and the trans PRK. Now if we look at this, we see that there are two ways to compare. One is the safety and the efficacy profile. Safety, that means how many will reach a 6x6, and efficacy, how many will stay there years and months down the line. And we see that SMILE and trans PRK have very similar safety and efficacy index. So we do not worry about if the patient will get that vision and will stay at that vision. Trans PRK has more regular epithelial healing. Now, there are two big hurdles on which everybody is going to gauge upon. One is pain and haze. Pain, I think we all use the term instant gratification, which is there, but I just would like to quote one dialogue from the movie Sarkar, that nazdeek ke fayde ke pehle dur ka nuksan dekh lena chahiye. If for 2 days of pain you are later going to risk this patient's eye, then I think pain for 2 days can be taken care of. And also there are bypasses to that. And haze, I do agree this point at a certain level, but we have seen in our experience with mitomycin C, which is the oldest formula, and I'm not talking of researches which are also coming up, in which people are working in things beyond mitomycin C, but yes, in today's scenario, and right now I have this patient, the oldest formula per diopter, 10 seconds of mitomycin C, we have seen very good results. And now that we have in the market with us immunomodulators like cyclosporins and doxycyclines, and our increased understanding with steroids and immunomodulators, we do combat the haze. So why are we in a hurry to bury PRK? I think PRK is not passé. We have this concept of AccuVale soaked BCL, in which you can soak your BCLs in these AccuVale unims, which is an acid. And we saw that on the Wong-Baker pain scale, the patient's pain on day one, if you're not using in a subset of patients to the ones in which you are using, the pain is substantially less and the patient is sitting more comfortably. So if it is instant gratification, yes, it's not as comparable, but safety profile, efficacy index, and when you know it's an athlete, again and again we highlight, and why this word was mentioned or given a part of the debate was that you need to be very safe and you cannot take a risk, even if it is few years down the line. Hence, and also this does not delay epithelial healing if this is the concern. So I think it's time we exhume PRK and we give it more chances, especially now that we have trans PRKs available with us. Thank you.
Thank you, Nimrita. You put forward a wonderful idea, but choice remains with the surgeon. And if we just exclude an athlete to a contact sports or any other profession, we need to evaluate every patient, every profession differently. And every surgery has its own benefits and drawbacks. But still, let's see what stands on the long way. It's not a joy for 1 day, 2 days. Let's take it for the whole life and consider it for everyone. For everyone, a profession like athlete or any other contact sport, profession is more important than immediate relief or gain in the first or 2 days. I think choice remains with the patient and a suggestion counseling by the doctor himself. Thank you. Thank you, everyone. We had a lovely time, and it gave us a broad view of what to choose when and what to take as a carry home message from this hall. Thank you, everyone, for being here so early. Some of them really without breakfast. Thank you very much.
Thank you. Thanks, Dr. Dhami.